Hi, I'm Erica Kennett, a registered sleep technologist at Ohio Health Sleep Services. In order to get a complete picture of someone's sleep, we need to record a variety of bodily signals. The meat and potatoes of the sleep study is 10 EEG electrodes that are attached to the scalp to record brain activity. With these, we can tell whether someone's awake or asleep at any given time, what stage of sleep they're in, and we can see when their sleep is disrupted by breathing issues, snoring, or leg movements. Since obstructive sleep apnea is the most common sleep disorder found during a sleep study, we also record bodily signals that indicate the presence of breathing abnormalities during sleep. With two sensors that sit under the nose, sleep techs record when someone is breathing and if their airflow ever decreases or stops altogether. Since snoring is one of the most common signs of sleep apnea, it's recorded with a microphone that gets taped onto the neck. Two belts around the chest and abdomen record breathing effort. While sleep apnea is the cessation of breathing during sleep, there are different types of apnea that are differentiated by whether someone is making an effort to breathe or just holding their breath. Since these types have different causes and often require different treatments, it's important to record breathing effort as well as actual airflow. Blood oxygen levels are measured with a pulse oximeter on the finger. This is particularly important to record as a lack of oxygen during sleep is often responsible for the heart conditions that sleep apnea can lead to. With two electrodes on each leg, we record leg movements that can disrupt sleep. These are usually related to restless leg syndrome or periodic limb movement disorder. A sleep study also includes 3 electrodes on the chin, which measure tension in the jaw muscles to detect if someone grinds their teeth in their sleep. The maroon channel shows chin tension, and the large bursts correspond to clenching or grinding. As you can see in the EEG channels below, chin tension is often so high when someone grinds their teeth that it causes tension in the rest of the head as well, causing bursts to appear in the channels that show brain activity. Finally, here's what all the channels look like when you put them together. At the top are the 2 eye movement channels, then the channel for chin tension, 6 EEG channels, 2 leg movement channels, the EKG, snore, airflow, and respiratory channels, and finally the pulse oximeter readout of blood oxygen levels. This is what sleep techs monitor and analyze during a sleep study, and each study consists of about 800 30-second pages of data. This particular image shows what normal sleep looks like. In contrast, this is what we see when someone has severe sleep apnea. By lining up breathing patterns and brain waves, we can see that every time this person stops breathing, they wake up for at least a few seconds to take 2 or 3 recovery breaths. A lot of the time, people aren't even aware of these awakenings, but they're the main reason that daytime sleepiness is one of the most common symptoms of sleep apnea. By putting together all the pieces of the sleep study, sleep techs are able to prepare study data so that the sleep specialist can see a comprehensive picture of what someone's body does while they're asleep. This allows them to diagnose sleep disorders and prescribe a customized treatment plan for each patient.